My name is Dr. Mike Fuller. I'm a sports med doctor at Panorama Orthopedics. Today I want to talk to you about impingement syndrome of the shoulder. The bone above the rotator cuff, which is this bone right here called the acromion, when that impinges onto the greater tuberosity, which is where the rotator cuff tendons actually insert. When you lift your arm up overhead, those two bones can pinch. And you can see on this model how that tendon itself gets pinched between the bone. That can cause inflammation and irritation and pain. Rotator cuff impingement usually occurs in overhead athletes, overhead workers, or people who do multiple repetitive activities. Impingement syndrome is typically because the rotator cuff becomes weakened. The rotator cuff, when it weakens, allows the humeral head to ride high, closer up to the impingement zone. When it's riding high, it'll impinge and cause the irritation. So the goal is to get the humeral head to ride centered in the glenoid, which is where the ball and socket sits. When I have you strengthen the rotator cuff, it can pull the tuberosity that it pinches on the acromion away from the acromion, which gives you more space to move. Shoulder impingement syndrome is treated first. We try to do physical therapy, either a home program or a supervised physical therapy program. If that fails, sometimes we will do a surgery which gets rid of the acromion, which pokes down onto the rotator cuff. If we can trim out the spur that pokes on the cuff, the pain can go away and you can strengthen your cuff again. So recovery process depends on how aggressive the impingement has become. If it requires surgery recovery is 2 to 6 weeks in general, to where the pain is more tolerable. You'll work on strengthening your rotator cuff in that recovery time.